Well, today we begin with a very serious topic, teen suicide. We're going to look at the warning signs and the risk factors that all parents must be alert to with the help of Dr. Elena Lister. She is a psychiatrist at Columbia University Medical Center, and I'm really, really happy to have you on the show.
I'm delighted to be here.
So this is a really tough topic for parents to even think about, which I think, of course, is part of the problem. What do you, when you counsel kids who are suffering from depression, you counsel parents who've lost a child to suicide or who have a child who's depressed. What do you hear from parents who have lost a child?
Parents who've lost a child by suicide are often racked with guilt.
Yeah.
That is the #1 feeling, which is why they try to deny any signs in the first place, and that's the second thing. They seem to be shocked.
Yeah.
Could my child have suicide? How can they believe it?
Right. And when you think about parents and what we really need to know about this, what are some of the risks? Who are most at risk when you look at a population of teenagers?
The statistics vary, but lately what we understand is that teenage boys are the probably #1 risk group. Also Native Americans, Alaska Natives, bisexual and gay, girls and boys, and really bullying, any person who's a victim of bullying.
Right, well, which is of course particularly relevant because it seems to me every day there's something in the paper about a child who's being bullied.
Exactly.
And certainly a child who's depressed, I mean, is very much at risk. What are some of the other factors? You mentioned relationships, I mean bullying, but also I'm assuming romantic relationships that goes badly, or the kids who, you know, they're very vulnerable at that age.
Yeah, I mean, in terms of psychiatric disorders, depression, substance abuse, in terms of relationships, it's really loss.
Yeah.
Loss of a deep friendship, loss of a romantic relationship, loss of a sense of esteem.
Yeah.
It's very common for teenagers who feel like they've failed in some way, disappointed the people in their lives, to feel as though they have no choice but to end it.
Really. And let's talk also about depression, because I think when we hear depression, we think about a kid just moping around and certainly, you know, having, you know, a very sort of sad affect and, you know, not eating and not sleeping. These are things, but you've mentioned a few other things that I was surprised about, and I'm assuming are different in boys than in girls.
For depression?
Yes.
Yeah, I mean, sometimes it's promiscuous behavior, it can be reckless behavior, it can be angry outbursts. It isn't only sadness and withdrawal.
Right.
And then the other things that there can be is sort of a diminishing in school performance. Drug use, turning to drugs, not necessarily abuse, but basically withdrawing into sort of numbing out against the world.
Right, using drugs to kind of self-medicate themselves and tune out.
Exactly.
So this idea of tuning out, and in fact you mentioned this idea of not seeing the people that they used to see, or not getting joy out of the things that used to be a source of pleasure.
Exactly. There's actually a psychiatric word for it called anhedonia. It means that usually things that are joyful have no enjoyment whatsoever. TV watching even, playing video games.
Right, right, and just kind of maybe just, would you have to be worried if a child suddenly, you know, who used to be very outgoing is very withdrawn? Is it a change in personality that you're also looking for?
Yeah, I just want to make sure though the change does not have to be abrupt.
Yeah.
When it comes to depression, it can be a slow, gradual change, which is why parents have difficulty seeing it.
Yeah.
At first they're going, their friends every weekend, then it's every other weekend, and then maybe it's not at all. They're withdrawing to their rooms even more.
Right.
They always have headphones in.
Yeah. As a parent, first of all, you have to be willing to fight the denial that we all have when our kids are depressed or sad, and just say, I think something's wrong here. And if you do suspect that your child may be struggling with depression, how can you go about addressing the issue of they're getting some help? Because, I mean, I think we've all gone through this, the moment where you say, you know, honey, it might be fine for you, it might be a good idea for you to talk to someone, and have your kid go, what, you know, I'm not crazy, I don't need to go to a psychiatrist, or I don't need to talk to my priest. I mean, what are some of the things you suggest to parents? It's just scripting that very important conversation.
It's a very wonderful question, a difficult topic, because teenagers are in the midst of trying to establish their independence, and then you come in and want to take it away by insisting they do something they don't want to do. I have the belief that if you have a thought as a parent, could my child be suicidal? That alone is reason enough to approach them about it. And I want to make sure that people understand that mentioning the idea of suicide does not give a teenager the idea of suicide.
Right.
If a teenager is not suicidal, asking them about them will not make them suicidal. If they are suicidal, what you've done is open the door for them to be able to talk to you about it. Because they are worried that you don't want to hear about it, that you're too scared or overwhelmed by it. I generally ask parents to say to their children things like, have you ever felt like you wanted to end your life? Like it just wasn't, you weren't worth having a life anymore? Have you ever felt like too much of a burden to us? Then if they don't want to go, I'm willing to say to somebody, I know this is going to make you furious. I am willing to have you be furious with me in order to do what I need to do to save you. And then I can use a medical analogy. Sometimes you don't want to take your antibiotics. They taste terrible, they're inconvenient. You have to do it in order to stay well. Same thing with going to see a professional.
Right. And, you know, in terms of some of these things that might make you think a child was suicidal, you had one, which I would never have thought of, which was that a child starts giving away possessions. Are there others that you tell parents that you would consider red flags?
Yes, I call these red alerts. And when they happen, I actually suggest to parents that they keep their child supervised until they can be seen by a professional. You mentioned giving away possessions. Statements like, I'm too much of a burden for anybody. Pretty soon it won't matter anymore. If they withdraw from friends, even more so than what we were referring to before, giving away the possessions to unimportant people, unimportant people especially, and also a different risk factor, which if there's a family history of suicide, then you have to be especially alert as a parent. Some of the best sources about your child can be the students, other friends of theirs, and faculty at the school. So if you need to speak to a professional but you cannot find a psychiatrist or a psychologist, there are clergy. There's always an emergency room. And there's an outpatient psychiatric department at every hospital, especially in Manhattan.
Really, really great advice on a tough topic, but a super important one for us to talk about and not just pretend it's not going to happen.
Absolutely.
Thank you so much, Dr. Lister, for joining us.